Todos and bienvenida, mis amigos. Welcome to the second lesson of Bilingual at Bedside. If you are a new subscriber here, just to give you a little warm, brief introduction, this is a YouTube channel dedicated to helping you and other medical providers learn Spanish in a clinical setting. So today we are learning how to collect patient information and a sample history as a first responder. And so I'm not sure how familiar you might be with sample history, but a sample is essentially an acronym used by emergency medical providers to allow us to successfully treat and assess patients. It will help you keep organized in a fast-paced environment where you would need to collect all the necessary patient information. And so the breakdown is just about six letters. So we have the signs and symptoms, the allergies as an age, medications, past medical history, the last oral intake, and the events leading up to the present illness and injury. So signs and symptoms, they include objective findings, such as, swelling or rash or whatever you visually see on the patient. And that also includes subjective experiences as well. So the symptoms that the patient tells you that they are experiencing at that current moment. The A stands for the allergies. So, the known allergies that the patient might have to any medications or foods or environmental factors and other substances that they might be allergic to, as well as their age, so how old they are. You can ask them, which is crucial to their medical state as well. And M stands for the medication. So, if you don't have, if the patient doesn't have a list of their current medications, you can always ask them the type of medications they're taking. And, they might not list all of them if they do have a long medication list, but at least gaining a few medications can give you an idea about how to treat the patient moving forward. And that will include like the certain dosages and any of the relevant past medications that the patient has taken as well. So the P stands for the past medical history. So past illnesses, the surgeries, the hospitalizations, the chronic conditions, or the family history that the patient has. And the L is the last oral intake, so anything that the patient has consumed prior to your encounter with them. And that includes like foods, drinks, or any substances, honestly, too, if they have taken something and have make you known that they have done so. And lastly, it's events leading up to present illness, that's injury. That will kind of help you understand the nature of the illness or the present illness that they're experiencing. And the events leading up to the patient's current medical situation. So what they did prior or what kind of could potentially had led them to exacerbate what they're feeling. All right. And so the first question we're going to ask is related to signs and symptoms. So in the setting that you are encountering the patient, you would ask them, what are your symptoms? What are you experiencing today? So the best way to ask this question would be, ¿Cuáles son tus síntomas? So ¿cuáles son tus is what are your, and síntomas is symptoms. So ¿cuáles son tus síntomas? And feel free to practice out loud in the comfort of your own home or your own space, because that really will help you put things into motion if you actually practice speaking them out loud. All right, now we're moving on to allergies. So our question that we're going to ask our patient today is, do you have any allergies to medications, foods, or any other thing? So that would translate to, ¿Tiene alguna alergia a medicamento, comida, o otra cosa? So have you had any allergies to medications, food, or anything else? And if that's a lot for you to digest at one time, you can also break this up into little questions separately. For example, you can ask them, ¿Tiene alergias? Like, do you have any allergies in general? Or ¿Tiene alguna alergia a medicamento? you can just break it up each one. So maybe that would just be easier for you to process in your brain as well as to ask your patient in more digestible forms of the question. So our next section is medicamentos, which is medications we learned on our last slide. And the question we're going to ask our patient is, what medicines are you taking? So in Spanish, this translates to, ¿Qué medicinas estás tomando? ¿Qué medicinas estás tomando? So, ¿qué is what? Medicinas is medicines. Estás is are you, and tomando is taking. So, tomar is the verb for to take. If you add ando at the end, it puts it in the present setting. So you're asking the patient what medications are they currently taking at this time. Now moving on to past medical history. And personally, I think that this is one of the most pertinent questions you could ask your patient as a first responder, because it really gives you a sense and grasp about how to move forward treating the patient, and it will give you a better idea about the patient's current complaints at that time. So we're going to ask our patient today, have you had any past medical problems? So that translates in Spanish to, ¿has tenido algún problema médico en el pasado? Have you had any medical problems? ¿Has tenido algún problema médico en el pasado? Penultimate question will be surrounded by our last oral intake. So we're going to ask our patient, when was the last time you ate? And this is an important question for if they are having abdominal pain, or important for if they might need potential surgery. You need to ask them, when was the last time that you ate? ¿Cuándo fue la última vez que comiste? ¿Cuándo fue la última vez que comiste? All right, and the last one we are going to uncover is the events leading up to present illness and injury. So I have two different questions here that I think are crucial to ask if you are in the setting, would be, what happened today? And how long have you had the pain? How long have you experienced the pain? So the first one, what happened today? You can ask them, ¿Qué pasó hoy? What happened today? What were you doing? And the next one will be, how long have you had the pain? Desde cuando tienes el dolor?